Happening right now, nurses at Rady Children's Hospital officially hit the picket lines after failed contract negotiations.
Fox 5's Elizabeth Alvarez is there live with more. Liz, good morning.
Good morning. This is definitely not the usual sight here in front of the ER at Rady Children's Hospital. We've got hundreds of nurses out here on strike. There's probably approximately 250 nurses who are on strike, who have formed picket lines in front of the ER, and really lines are in and around the hospital. You can see there are two lines that have formed right in front of the ER as you're looking live at these images via Skyfox. I can tell you there are a total of 1,600 unionized representative nurses that are striking until Wednesday. Many of the nurses out here, you'll notice some of them are in scrubs, others are in regular clothing. Most are holding signs on strike for this cause having to do with better wages and better benefits. You see, the union representing these nurses struck down an agreement yesterday with Rady Children's Hospital administration. They actually voted down that agreement for the second time. The newest offer, just to give you some background, is a 3-year contract, a 25% increase over time, and a market adjustment to their base rate. But I just talked to a nurse who says, look, while on paper that sounds like possibly a good deal, she and many other of her colleagues tell me that they are struggling. They said if we are out here, she says that's because there's something wrong. She explains how devoted she is to nursing, but she is just struggling personally, she says, and a lot of it has to do with the work benefits or lack thereof. Take a listen.
Well, I work 2 jobs personally to make ends meet on top of my husband working. I have a child with medical needs who hasn't even been able to receive specialty care here. Even as an employee of Rady Children's Hospital, they didn't accept our insurance. I think that would surprise a lot of the public to know that we as nurses at Rady Children's Hospital have some of the worst benefits in the hospital system in San Diego County. Our premiums have gone up 34% in the last 3 years, and they're just continuing to go up. Our co-pays are getting higher, and we just can't keep up.
All right, so that's perspective from one nurse out here. Now, not too long ago, we heard from the president and CEO here at the hospital responding to the strike and also how the hospital is managing with so many nurses now on strike. Here's what he told us.
This was unfortunately after a series of back and forth negotiations over the past several months. And we had reached 2 separate tentative agreements that were both rejected by the nurses, the most recent one yesterday. This agreement would have provided an increase of an average of 25% compounded over the next 3 years for the nurses, and that's inclusive of a base pay market adjustment, shift differentials, a revision of the stepped ladders that they have, as well as other pay differentials. Now our focus turns completely, as always, to the children and making sure that we're here to care for the kids every single day. We have hundreds of nurses who've come here to support us from across the country and work alongside our care teams. They're trained in pediatrics and come from some of the top children's hospitals across the country.
So back out here live again, picket lines have formed now. These unionized representative nurses will be on strike through Wednesday morning. And just to keep things in perspective, as I mentioned, just right now there's approximately 250 nurses out here on strike. Most, if not all, are from Rady Children's Hospital, but Teamsters is also involved in this. They are busing in physicians and other nurses from San Bernardino, from the LA area to help the cause. So we're keeping an eye on things, but this strike for sure will be happening through Wednesday morning. And that is the very latest here in front of Rady Children's Hospital, guys. We'll have more for you as we go along in the next few days.
Liz, thank you for that update.